حياك الله دكتور، شو اخبارك؟ Excuse me. خلاص, we can start. Please take your seats, please. السلام عليكم ورحمة الله وبركاته. بسم الله والصلاة والسلام على رسول الله وعلى آله وصحبه أجمعين. It's my pleasure to speak today on a very hot topic, an important topic that has attracted the attention of the entire world, and this is Ebola. And we just want to go over this disease and see whether we are really prepared or not. After my lecture, I'll probably spend maybe 40 minutes, 45 minutes describing the Ebola and the different preventive measures and maybe diagnostics and preventive and therapeutic interventions. And then we'll demonstrate to you a very important aspect of prevention, which is the donning and doffing, or putting on and removing PPEs, or personal protective equipment. And this will be demonstrated by our nurses in the infection control unit. I have no conflicts of interest in relation to this presentation. So I'll just try to go over the following. I'll give you a brief classification of viral hemorrhagic fever and the viral hemorrhagic fevers that we've reported in Saudi, and then modes of transmission, and then I'll zoom in and speak about Ebola. So let us start with the viral hemorrhagic fevers, اللي هي الحميات الفيروسية النزفية بالعربي. So what is this entity? It's a group, actually. It's not one disease. It's a group of illnesses that are caused by several distinct families of viruses. Okay? And it's used to describe severe multisystem disease that cause damage to the vascular system, leading to leakage of plasma and other proteins into the extravascular space, and often leads to bleeding as well. And this may, as a result, lead to shock. Okay. The bleeding itself is rarely severe enough to cause death. However, the patients do die in some of these diseases, particularly Ebola, because of the overwhelming sepsis that they get with the virus itself and the vascular leak. So this is how we classify viral hemorrhagic fevers. We have four main groups that cause viral hemorrhagic fevers. The arena viridi, and the most common and the most maybe famous of this group is the Lassa fever, Humma Lassa. And this fever is actually, or this disease or viral hemorrhagic fever is common in Africa, Western Africa, where the Ebola outbreak now is taking place. And Lassa fever causes about 500,000 infections per year in West Africa, Guinea, Sierra Leone, and Liberia, where we have the outbreak of Ebola. And it kills about 5,000 people per year. 5,000 people per year. So it's really a very common and serious infection. The mortality is about 1%. But if you consider the number of patients that we have every year, 500,000 per year in West Africa, then the number of deaths is really huge, 5,000 people every year. So this is one of the diseases that you always have to consider if somebody comes from West Africa. It's not only Ebola that you have to think of. Actually, Lassa is more likely than Ebola in somebody presenting with viral hemorrhagic fever from West Africa. The other ones like Jenin, Machupu, Guanarito, Sabia, and Luju are less common viral hemorrhagic fever in the arena viridi group. that is common in South America. Okay? The second group is Bunia viridi. So Lujo is common in South Africa, but the rest, the Jenin, Machupu, Ganarito, Sabia are common in South America. Lujo is a very new one. Lujo is a very new one that has been reported from South Africa, Junub Africa. The Bunia viridi group includes two important viruses, the Rift Valley fever, حمى الوادي المتصدع, which caused a big epidemic back in year 2000. And alhamdulillah, ever since we haven't had a case. The second is Crimean Congo hemorrhagic fever, which has also caused an outbreak, or had caused an outbreak back in 1994 in Saudi. And I'll talk more about this shortly. And then we have the hantavirus group, which causes hemorrhagic fever with renal syndrome and hantavirus pulmonary syndrome. Okay? All of these belong to the Bunia viridi group. And then we have the filoviridi. Philo comes from phylum. Phylum in Latin is thread. So they're called filoviridi because they look like threads. خيوط, خيطية, فيروسات خيطية. And this includes Ebola and Marburg. Flaviviridi is the fourth group, and this includes two important infections that are really common and still active in Jeddah, particularly, and also in Mecca and Najran, dengue and al-Khumra, hemorrhagic fever virus. Okay. We also have tick-borne encephalitis, Omsk hemorrhagic fever, Chiasanor forest disease, and yellow fever. So these are the most important causes of viral hemorrhagic fever that we may encounter in our practice. The red ones, the ones in red, are the ones reported in Saudi. One important point about these diseases is that all of them are zoonotic, meaning they come from an animal origin, except dengue. So, and this is really a common factor in all of these infections. Now let us just look at the animal reservoir of these viruses. If you look at the Arena viridi, it's mainly rodents. Bunia viridi, we have sheep and goat, livestock animals, and also for the Congo Crimean, sheep and goat. For the hantavirus, it is rodents again. For Ebola, and we'll talk more about this, we have different animals that are implicated as reservoirs of Ebola, like fruit bats, chimpanzees, gorillas, monkeys, forest antelopes, and porcupines. For dengue, we don't have any animal reservoir. For al-Khumra virus, we have sheep, goat, and camels. And for tick-borne encephalitis, we have ruminants and dogs. And for Omsk hemorrhagic fever and Chiasanor forest disease, we have rodents. And for yellow fever, we have monkeys. So all of them have animal reservoir except dengue. This is just pictures of the different rodents that maintain the virus in nature in the Arena viridi group. For the Lassa, we have this called natal multimammat rat, and we have different species of rats that maintain the other viruses, the Jenin, Machupu, and Guanarito, Sabia, etc. This is the Rift Valley fever, just to remind you that this disease, حمى الوادي المتصدع, is another viral hemorrhagic fever that you have to consider in any patient presenting with viral hemorrhagic manifestations in the kingdom. And it is transmitted by direct contact with livestock animals like sheep, goat, and camels, and also by mosquitoes. Okay? And actually, any mosquito can transmit Rift Valley fever. It doesn't have to be Aedes aegypti, as the case with dengue. We have the Congo Crimean hemorrhagic fever, اللي هي حمى القرم نسميها, حمى القرم بالعربي. Okay? This is a very serious infection, very, very serious. Patients usually acquire it by contact with animals, like sheep, goat, and cattle, and then they present usually with acute abdominal pain. And what is interesting about this disease, it is communicable or infectious from person to person. And when such patients present with acute abdominal pain, they are often taken to the OR by the surgeons. And oftentimes, the surgeons get infected. and the mortality is very, very high. So keep in mind that so Congo Crimean hemorrhagic fever is one of the diseases that may present with acute abdomen. So you really have to look at the PT, PTT, platelets count. If there is any suspicion of this disease, please don't try to stick to the infection control precautions, wear full barriers to protect yourself, particularly for the surgeons. Now the hantavirus has rodents. This is the rodents that maintain the hantaviruses in nature. I'll speak about Ebola later on. And then we have the dengue. Dengue has no animal reservoir, and it's transmitted by mosquitoes. The mosquito species that transmit dengue is Aedes aegypti and Aedes albopictus. One thing that I forgot to mention about Congo Crimean hemorrhagic fever is that it is transmitted by ticks. So some of the viral hemorrhagic fevers are transmitted by mosquitoes, and others are transmitted by ticks. And I'll talk more about this shortly. Then we have Al-Khumra virus, which is a novel virus that we discovered in Jeddah and then Mecca and now in Najran. It is transmitted by direct contact with animals, and also believed to be transmitted by mosquitoes and maybe ticks as well. Okay? It's a serious disease, more serious than Rift Valley fever, tends to cause encephalitis, and mortality can be up to 25%. And it's Al-Khumra virus was named after Al-Khumra region south of Jeddah. Let me skip these ones. The yellow fever is another important differential that we have to consider in people coming from Africa with jaundice or viral and hemorrhagic manifestations. It's mainly transmitted by mosquitoes, and there is a vaccine that prevents yellow fever. So, and we recommend this vaccine for people who are traveling to sub-Saharan Africa to protect them from yellow fever. It's really a serious disease too, often fatal, so, and it is preventable. And the animal that maintains it in nature is monkey. This is just a table that summarizes these viruses and which ones are vector-borne and which ones are human-to-human, are transmitted from human to human. As you can see, the arena viridae have no vectors. They are transmitted usually by inhaling the excreta of rodents. You don't have to have a vector to transmit Lassa fever, for example, and others. And they can be transmitted from human to human. So Lassa fever is infectious, as well as the others, most of the others. Rift Valley fever is transmitted by mosquitoes, and Congo Crimean by ticks, as we said. But only Congo Crimean hemorrhagic fever is transmitted from human to human. Rift Valley fever is not. And then we have Ebola and Marburg. Both have no vectors. There's no transmission by vectors like mosquitoes or ticks, but they can easily infect humans. Infection can easily be transmitted from human to human. The dengue and Al-Khumra have mosquitoes and ticks as vectors, and they are not transmitted from human to human. So just to summarize the mosquitoes that may cause infections in our practice, we have the Aedes aegypti, which have this characteristic color and dots, white dots, and this can transmit dengue, yellow fever, and a disease called chikungunya, which is an emerging also disease that resembles dengue. It causes joints pain that can be prolonged after acute febrile illness. The Culex mosquito can cause many diseases, including Rift Valley fever, West Nile encephalitis, filariasis, Japanese encephalitis, and St. Louis encephalitis. And we have the Anopheles mosquitoes, which may cause malaria. Malaria is also another important differential in anyone presenting with DIC or coagulopathy, jaundice, hepatitis from Africa. And this is actually much more common than viral hemorrhagic fever. Okay. So now let us talk more about Ebola. Ebola, as we said, is one of many viral hemorrhagic fevers. It is a severe, often fatal disease in humans. And it also causes infection or disease in non-human primates, like monkeys, gorillas, and chimpanzees. So it doesn't only kill humans, but it also kills gorillas and chimpanzees when it causes an epidemic. It's caused by infection with a virus from the family Filoviridae and the genus Ebola virus. This is just pictures of the virus. As you can see, it is thread-like that can take any morphology. Okay. This is one of the patients suffering from Ebola in Africa. This disease is actually an African disease, has never caused epidemics, big epidemics outside of Africa. Okay. The first Ebola virus was discovered back in 1976 in what is now known as the Democratic Republic of the Congo, formerly Zaire, and زمان اسمها Zaire. Now it is known as the جمهورية الكونغو الديمقراطية, Democratic Republic of the Congo. This was the first area when the virus was identified back in 1976. And in that country, there's a river called Ebola that was near the first cases identified, and hence the name was given to this virus, Ebola, which is just a river, Zaire, or جمهورية الكونغو. Since that date, many outbreaks have been reported in the literature. Now, this is just a map that shows the geographic distribution of Ebola virus, where it caused outbreaks. The ones in red are the hottest areas. As you can see, the Democratic Republic of Congo is a hot zone where we had 8 outbreaks. And actually, we recently had a new outbreak that is unrelated to the Western Africa outbreak that I'll give you details of very soon. Now, we have a total of 1,029 in these 8 outbreaks in the hottest country. If you compare the current situation in Western Africa, where this is considered to be the first outbreak in West Africa of Ebola, the first outbreak in history. And until now, we have 7,700 confirmed cases, just in one epidemic. So this shows you that the epidemic in Western Africa is actually huge. This is why everybody's worried. It's really huge. In 8 outbreaks we had in the worst country in history since 1976, we had 8 outbreaks with only 1,000 patients confirmed. In West Africa now we have only 1 outbreak with more than 7,000 people confirmed to have Ebola. So it's really very serious. We also had outbreaks in Uganda, 5 outbreaks with a total of 592 patients. We had outbreaks in Sudan, okay, where we had about 335 patients affected in 3 outbreaks. We had also outbreaks in another Congo. We have 2 Congos, the Democratic Republic of Congo, وفي الكونغو العادية, country ثانية اسمها Congo, which is another hot area for Ebola, and we had 3 outbreaks with 235 patients getting infected. There's also a country called Gabon that had 4 outbreaks with about 200 people getting infected. We had scattered cases in Senegal, Ivory Coast, Sahel al-Aj, Nigeria, etc. Nigeria, you've heard of the Nigerian maybe outbreak that happened recently from an American Liberian who got infected from West Africa, and he was trying to go to the States to be treated. So he flew to Lagos in Nigeria to take a flight to the US, but in the airport he was sick, so he was admitted to Nigerian hospital, and that case caused a big transmission that affected 20 people. Many of them died. So the disease can be easily transmitted by traveling. So these are just the outbreaks. I put them here for those who will use the handouts, just to see the history of these outbreaks, where they occurred, etc. But I'm not going to go over them. But I'll just highlight one important outbreak that happened recently, which is an interesting one. in the Democratic Republic of Congo, which is known historically to be a hot area for Ebola, a man hunted an animal, a wild animal, and gave it to his wife, who was pregnant, and she cooked that animal, and that animal was apparently infected with Ebola. The woman got infected from this animal, and she died. And then in their rituals, they cannot bury a woman who's pregnant. She has to be delivered, even if she's dead. Even if the baby is dead, they have to deliver them, to deliver the baby. So the baby was dead, and the woman was dead. But because their tradition said they have to deliver the baby, to bury them separately, so the surgeons took this woman and delivered the baby. And then all eight healthcare workers who got in contact with this woman got infected and died. All of them. Yes. And a total of 66 cases actually got infected from this woman in Democratic Republic of Congo. And this was proven to be unrelated to the Western African species. So this shows you how easily this virus can be transmitted if you're not careful. Now this is the summary of the cases in the Western Africa. We have Guinea. We have a total of 1,667. 61% of them died. In Liberia, we have 6,500 تقريبا, and 37% of them died. In Sierra Leone, we have a total of 5,300 تقريبا, and 28% of them died. So the total suspected and confirmed cases is 13,500, and the average death rate is 36%. The confirmed ones are 7,700 تقريبا. So this is really huge. We've also had transmission elsewhere outside of Africa as a result of traveling. And Nigeria was one example. We had 20 cases, 8 of them died. We had one case in Senegal. We had one case in Mali, a child who died, 2 years of age. And in Spain, we had also one. And we had 4 in the United States. Naha, this is our messenger, peace be upon him, prohibited eating any wild animal with fangs or canine teeth, and any bird with talons or claws. So these are really prohibited in Islam. And this is just an example of the canine and the mekhla bilua. But we cannot really eat cats, for example, or rats, or dogs, or lions. These are prohibited in our religion. So now, what are the manifestations of Ebola? The incubation period of this disease is ranging from 2 to 21 days, but usually from 8 to 10 days. Patients are infectious only during the febrile illness, after the onset of illness. Before the onset of illness, they are not infectious. And this is important for us to do our public health tracing. For example, just 2 months ago or so, we had a traveler, Saudi man, who went to Sierra Leone for business. He's a businessman who sells gold and other jewelries. So he went there for business, and when he came back, he suddenly, on the way from Taif to here, he had acute onset of fever, and he started to vomit. And then he was seen in several hospitals, and they did not really think of Ebola, just because nobody asked where this patient came from. And this patient had recently come from Sierra Leone. And the onset of his illness was 10 days before his arrival. So eventually he went to one of the private hospitals, the big ones, and in there they suspected Ebola, because they knew that he was in Sierra Leone, and they heard about the Ebola problem in Sierra Leone, so they notified us. So we took this patient and admitted him in our Ebola designated center in Ministry of Health, and we of course did the investigations. طبعا للأسف we could not confirm what the disease was. The Ebola tests were negative for that man. And we sent it to the CDC. We did it in the university hospital because this is the only place in the kingdom that can do biosafety level 3 viruses. So our test was negative. We sent it to CDC and we sent it to Robert Koch Institute, and they could not really identify any pathogenic agent. We looked for Lassa fever, we looked for other viral hemorrhagic fevers, all of them were negative. This patient eventually, Allah yarhamu, Tufi, died, and we still don't know how he died. But I strongly suspect that he died of either Ebola or Lassa, because he had really typical viral hemorrhagic fever. But sometimes you can have false negative results. The reason I mentioned this case is that when this patient traveled from Sierra Leone to Jeddah, would you trace the contacts in the plane of this patient? No, you wouldn't really bother tracing them because he was not symptomatic when he flew. Symptoms started 10 days after he arrived. So we really don't care about the contacts that happened before the onset of illness, because patients become infectious only after the onset of infection. So if you want to do contact tracing, you have to take all the contacts that the patient had contact with after his acute illness. One important thing about this virus is that men who recovered from the disease can still transmit the virus through their semen for up to 3 months. So we advise men who recovered from Ebola, God forbid, not to have any sexual intercourse with their wives or vice versa until at least three months have elapsed. And also breast milk can be infectious up to 2 weeks and maybe longer. So we also advise women who recovered from Ebola not to breastfeed her babies. Okay. Symptoms include fever, severe headache, muscle pain, weakness, diarrhea, vomiting, abdominal pain, lack of appetite, and bleeding manifestations. Very non-specific. Very, very non-specific. So how should we suspect Ebola? These really very non-specific symptoms that can be caused by dengue, can be caused by even just simple respiratory infection. The clue to Ebola, if you have any acute febrile illness or acutely ill patients who come from Western Africa. This is our case definition. So anyone coming from West Africa, Sierra Leone, Liberia, or Guinea, with an acute illness should be suspected as a case of Ebola. Okay. If there's no history of such travel or coming from these countries, you really don't have to worry about Ebola. This is just a picture of a woman who's bleeding. They can bleed from anywhere, from any orifice, like mouth, nose, vagina, rectum, urine, urinary tract, and they can have cutaneous bleeding, etc. This is having just bleeding in the mucous membranes of his mouth. Now, how is this virus transmitted? Researchers have hypothesized that the first patient becomes infected, as I said, through contact with an infected animal. And this is what ignites the whole epidemic in Africa. And then infection is transmitted from human to human. Infection is easily transmitted from human to human. And this can be through direct contact with a live or dead sick person, blood or other body fluids, such as urine, saliva, feces, vomit, sweat, sputum, and semen. So even sweat may have the virus and can be infectious. This is why we don't allow touching any patient with Ebola. As per our standard precautions, we say you can touch your patient without gloves if he doesn't have secretions. But for Ebola, it is prohibited because even the sweat, if you touch the patient's sweat, which is usually not infectious, for Ebola cases, it can be infectious. So it's really dangerous to touch any patient with Ebola without wearing full PPE. It can also happen as a result of contact with alive or dead infected animals. Including also blood, other body fluids, or meat. And this is a common way of transmission in Africa. And as I said, it can be the first or the reason for the first cases in an epidemic. It can also happen as a result of needle stick injuries, by needles used to draw blood or to inject patients with Ebola. This is why safe needle practice is very, very important. And one of the common needle malpractices that people may do is recapping. So we don't recommend recapping, not only for Ebola, but for any other disease. Recapping is prohibited. Just throw the needle away in the garbage without, the sharp bin, without recapping it. Healthcare workers and family and friends in close contact with Ebola patients are at the highest risk of getting sick because they may come in contact with infected blood or body fluids. So we usually see such infections among the household contacts of patients as well as healthcare workers who really come in very close contact with patients. These are at the highest risk. And people also who deal with the bodies, the dead bodies, when they bury them or when they wash them, are really at very high risk. Even though the body is dead, it is still highly infectious. Actually, they found that the virus shed from a dead person is really huge, more than a live person. So it's really very important to be careful with dead people as you do with live people. It was an Ebola case, so we can get it anytime. One of the things that the Ministry of Health did to prevent importation of the virus into the kingdom is banning visitors or pilgrims coming from these countries. So we don't give them visas to come. Anyone from these countries are not given visas to come to our country. And this has been in effect since April. And this is really very good, because I think this is one of the important means that prevented introduction of Ebola into the kingdom during particularly Hajj, because we have really a lot of people coming for Hajj, and we could have easily imported Ebola during this huge gathering. We also recommend that people don't travel. This Saudi man did not live in West Africa, but he traveled to there. And we recommended that people should not travel to West Africa so that they don't get infected and introduce the infection to our country. And we've also done some measures to make sure that people coming from other countries, say somebody from London or from the States or from China, when they go to the airport, when they come to our airport, we're now developing, we haven't yet implemented it, but we're developing a mechanism to check whether such people have visited the Western African countries in the 21 days prior to their coming to us. And this is another means to prevent introduction of the disease. So this is at the public health level. These are some measures at the public health level. But at the local or hospital level, you really should know how to manage patients with suspected Ebola. So such patients should be immediately isolated under contact and droplet precautions. Contact and droplet precautions. And such patients should be kept in a single room with an adjoining or adjacent dedicated toilet that should only be used by the patient, and it should be equipped with a sink. I mean, these are very simple measures that we have here, but you won't believe that people in Africa don't have such even sinks. They don't have even running water in Africa. This is why we have to emphasize them in our lecture, even though they sound very basic. So there should be a sink equipped with running water. There should be soap and single-use towels, alcohol-based hand rub dispensers. There should be stocks of personal protective equipment by the room, and stocks of medicines. We should keep the patient's medicines. For example, the patient is on antihypertensive or on anti-diabetic or whatever. You should not mix their medications with the rest of the pharmacy. You should keep the stock of medications in the patient's own room so that they don't mix with the others, because the surface of these bottles may be contaminated with the virus. The room has to be well ventilated, and the windows have to be screened, not because Ebola is transmitted by mosquitoes, but because yellow fever is one of the differential diagnoses of viral hemorrhagic fever in people coming from Africa, and yellow fever can be transmitted by mosquitoes. So For that reason, you have to make sure that the windows, if you have open windows in the hospital, have to be screened. يعني في شبكة تمنع دخول المosquitoes. Doors should always be closed, and the access to the room should be restricted. Only people taking care of the patient should go in. And you have to keep a log book for those who are entering and exiting. For example, I went to examine a patient, and I have to write in the logbook when I entered, my name and the time I entered and the date, of course. And when I exited, I should write this on this log. And you should keep track of all people who entered the room, even if they are not healthcare workers, like family members or whatever. If isolation rooms are not available, you can cohort patients, and you can keep patients with confirmed Ebola together, but don't mix them with cases that are suspected. So if Ebola cases are, for example, you have 2 patients or 3 patients with confirmed Ebola, you can keep them in a common room if you have to. It's better to keep them in single rooms, but if not, then you can cohort people with confirmed Ebola, but don't mix them up with suspected cases, because the suspected ones may not have Ebola and may get infected from the confirmed one. Okay? You have to make sure that the distance between the beds is at least 1 meter. You have also to ensure that clinical and non-clinical personnel are assigned exclusively to the Ebola virus disease patient care areas, and that members of staff don't move freely between Ebola isolation areas and other clinical areas. And this is really very important, that you should only allow very well-trained staff to take care of the Ebola case, and such staff should not cover other patients. So if it is one patient, then this one patient should have a dedicated nurse or 2 nurses to cover each other, and they should not see other patients. Very, very important, so that you prevent cross-infection. And you have to limit the number of persons entering the patient's room to those essential for care. And as I said, you have to maintain a logbook of all persons entering and exiting the patient's room. Now, one important recommendation is that any healthcare worker who will be involved with the management of Ebola should receive extensive training prior to being allowed to treat such patients. And this is really very important. And they have to demonstrate competency, that they are well trained and they are well oriented to the infection control precautions that they have to observe during their management. One important thing that has been changed recently after the cases in the United States is that previously the CDC recommended regular gown or fluid-resistant gown and face shield and masks, but the neck was allowed to be exposed and the legs were allowed to be exposed. Now they changed that. Now you're not allowed to keep anything exposed in your body. You have to cover everything, the neck, etc. And this is a new change that happened just very recently. And another thing that they have also recommended after the outbreak that happened in the States is that the overall safe care of Ebola patients in a facility must be overseen by an on-site manager at all times. Like there should always be a manager to make sure that all infection control precautions are going well, and that each step, not only a general manager for that, but also each step of donning and doffing PPE is observed by a trained observer. So if a nurse is intending to go in, then the nurse should be accompanied by another nurse to observe her, trained observer, who should observe her putting on the gowns and the PPEs, and then when she goes out, she has to also be observed by the same trained observer. So this is really somewhat not very practical in many centers, particularly so say for Africa, where you have thousands of people. You might have this possible. But in our facilities where we will have only a few patients, I think we can easily do that. And we'll demonstrate to you this after my lecture. Maritas and Marisa will demonstrate to you how to don and doff the personal protective equipment. This used to be the previous recommendations. They recommended gloves, but now they recommend double gloves. They recommended a gown that is fluid resistant, where you can keep your neck open, but now they recommend a hood as well. Previously, they recommended a face mask or an N95 mask, respirator, a face shield, which is still recommended, and now they also recommend leg coverings. So this is what you should really use for leg covering. And the hood, we'll show it to you. It's just like الحجاب اللي بيلبسوه المسلمين. This is the so-called hood. Just wear it, and we'll show it to you. So this is your face, and this is meant to cover the neck. Or you can use. We'll show you all the equipment shortly, so that you really have to be familiar with the equipment, with these so-called personal protective equipment, PPEs. So you really have to know how they look and which one to use and why you have to use certain types, etc. And we'll show you all of this in the demonstration. So let me just go quickly over the rest so that we can demonstrate the donning and doffing. It is when the nurse or the doctor goes out of the room, it's very, very important, very, very important to remove the PPE carefully in a way to avoid contaminating one's mucous membranes or hands or body. Because most of the infections that happened outside of Africa happened, and even maybe in Africa, happened as a result of erroneous removal of PPE. So PPE can protect you, but when you remove them in the wrong way, actually they will be harmful. They will be harmful. So you really have to know not only how to don them, but you have to know how to doff them. Okay, we'll give you the details of this. This is just details of the steps, step by step. And this is now recommended by the CDC, that the trained observer would read out the steps to the one who's going inside the room. Every time she wants to go, she will just read out the list, step by step. And this will be demonstrated very shortly. One important thing is that don't forget to disinfect the environment after taking care of a suspected Ebola case. And one of these things that are commonly forgotten is the stretcher in the ER. When you move a patient from one area to another, you really have to disinfect it. Not only for the MERS, also not only for the Ebola, also for the MERS corona, and also for any other infectious virus that can be transmitted by failure to disinfect surfaces. Okay. You have to be careful if a patient dies. You have to be careful with the dead body. Washing the body is not recommended outside the hospital. So for Ebola, we don't recommend that the family will take the body and wash it outside, because the washer, موسل الموتى, may get infected if they are not careful. So we recommend that the bodies are washed inside the hospital by a trained healthcare worker. He should be the one washing the body. And the duration of precautions as to when to stop isolation depends on how the patient is doing. There is no specific duration. As long as the patient is ill and sick or having symptoms, they should be isolated. And then when their symptoms resolve, you can discharge them. However, you have to warn them that for men, that the semen can be infectious. So they should avoid sexual intercourse. And for the woman, if they are pregnant, to avoid breastfeeding. This is just some pictures of what's going on in Africa. Okay. Some of them have really good equipment, but they are often not disposable. So they use reusable gloves, and they wash them and hang them to dry. And this is really not recommended. If you have the money to buy disposable gloves, then it is better to do that, because washing such gloves may expose the washing person to the risk of infection. So we don't recommend this, but I'm just showing you what's happening in Africa. The poor guys don't really have enough resources to protect themselves, and this is why the infection is spreading really tremendously. This is just some of the beds that they use. As you can see, very primitive beds, very primitive facilities. Okay. Well, this is with the help, by the way. This is now United Nations and CDC's and WHO's hospitals. This is doing this help, they have really nothing. They treat their patients just on the floors. As you can see, they don't have running water. They use this to wash their hands, etc. So they are really in a very poor situation. This is the nurses donning their PPEs. This is one of the patients taken care of on the floor on a mattress. And nurses there and healthcare workers have to do the burying itself. So they recommend that the burying itself, not only washing if they wash, but also burying the patient should be done by the nurses and the doctors so that they don't expose the lay people to the infection. So nurses have to do that themselves. If you have to travel to an area with known Ebola case, we don't recommend this. You have to avoid the following. This is just an advice because some people may still decide to travel to West Africa, even though this is not recommended. If you decide to do so, then you have to practice really careful hygiene, avoid contact with blood and body fluids, obviously. Don't handle items that may have come in contact with an infected person's blood or body fluids, and avoid funeral or burial rituals. يعني لا تروح مراسم دفن ولا مراسم عزاء in Africa, because the body can infect you. Unless طبعا a relative or لا سمح الله يعني, then you have to take precautions. Avoid contact with bats and non-human primates, or blood, fluids and raw meat prepared from these animals. طبعا الحمد لله نحن as Muslims we don't eat such meats, بس أحيانا واحد doesn't know, ممكن تروح مطعم تطلب لحم يعطوك لحم فيران وانت متداري. So be careful. Avoid hospitals where Ebola patients are being treated, and after you return, monitor your health for 21 days and seek medical care immediately if you develop any symptoms. Now, how we diagnose Ebola? طبعا, diagnosis is another headache because you cannot really, as recommended by WHO and most experts, testing should be restricted to special labs. So you cannot do Ebola testing in any lab. Even in our research center here, we did it actually not formally, not as a formal test, because our lab has not been approved by the WHO to be a lab for testing Ebola. Only few labs in the world are allowed to test for Ebola. And this is why we had to send our specimens to CDC and to Robert Koch Institutes, which are approved for that. The test that you do to diagnose Ebola includes antigen, capture ELISA, and IgM ELISA, PCR, and you can also isolate the virus by culture. You can also check serology. You can take convalescent and acute and convalescent sera. And you can also, of course, take biopsies or autopsy from dead people and stain it with immunohistochemistry tests and PCR, or try to isolate the virus from the dead body. So all of these are the diagnostic tests that we can use. Ebola is a biosafety level 4, not 3, biosafety level 4 virus, which means you cannot isolate it in any lab. Even in the research center, you cannot do viral isolation in our research center because it's biosafety level 3. You can do the PCR, because PCR deals with inactivated RNA. But you cannot do culture for Ebola in our lab. You have really to send it to a biosafety level 4 lab. In that lab, as you can see in this picture, people wear full PPE with powered air purifying equipment connected to the pump. As you can see, this is the hose that pumps air into this suit. It's just a suit that is positively pressurized so that they don't get infected. So these special suits are only available for the biosafety level 4 labs. We do actually have them in our biosafety level 3 lab, but it's still not complete. We don't have the other settings to be a biosafety level 4 certified lab yet. Treatment, is there any treatment for Ebola? Unfortunately, none. Supportive care does improve patients' outcome. So by just improving patients' hemodynamics, giving fluids, treating any secondary infection, treating any bleeding diathesis with fresh frozen plasma or platelet transfusion, etc., may actually dramatically improve the outcome. So supportive care is basically the way to go. There are some experimental medications. One of them is the so-called ZMapp. ZMapp is a monoclonal antibody developed in humanized mice. They engineered the mice to be able to produce human antibodies, and they now produce this called ZMapp, monoclonal antibodies that may neutralize the virus. And the supply now of this new medication is very, very limited. There was an ethical discussion about its use because it has never been used before, and this will be the first time they use it to treat patients. So we had a meeting. I was a member of that meeting among researchers in the world about 2 months ago to decide whether we can use ZMapp or not. And all of us agreed that for the West African epidemic, it would be justified. When we looked at the data, the preclinical data, we found that it is very unlikely to be unsafe, and that the preclinical tests on animals were actually very encouraging. So we decided that they can use it, and they can go ahead and use the ZMapp to treat patients with Ebola in West Africa. So this is basically what I wanted to discuss with you today. And now we'll demonstrate to you how to don and doff PPE. And this is really very important. It will take maybe 15 more minutes, and then we'll open the floor for questions. Thank you. Have microphone.
Good afternoon. Good afternoon, everyone. We're going to demonstrate to you today the proper sequence of donning and doffing personal protective equipment when we attend to a suspected or confirmed Ebola patient. As what was mentioned a while ago, it is a new recommendation to assign 2 nurses, one that is a trained observer and the primary healthcare worker for the entire shift, and they are only dedicated for this patient. My name is Marites. I will act as the trained observer, and as you can see, I am wearing now the scrubs and the fluid-resistant gown with my gloves, face shield, and booties. My colleague here, Marisa, will demonstrate the whole process and sequence of donning and doffing PPE. But before we proceed, we have to make sure that all PPEs required are laid, all sizes are available, and they are in good condition to be ready for her to use. So what are these things? These include the inner gloves made of nitrile.
Just, sorry to comment. These gloves are special gloves, by the way. They have an extended cuff. show them the difference between this one and the regular one. So you have to use the gloves that have extended cuff, طويلة, not the regular one.
The booties that extends up to the mid-cuff. We also have the shoe cover. This is just to show you the difference between the two.
So one is called shoe cover. This is just to cover the shoes. The rest of the leg will be exposed. This one is what you should use. Booties. It covers the leg up to the knee.
Appropriate size of fluid-resistant gown. We have different types of gown. We have the coverall without the hood. The coverall with the hood. And the fluid-resistant gown, just like the one I'm wearing right now. All these gowns should allow free movement and free flow. N95 respirator mask. We have different types of N95. We have the duct type, the particulate respirator, and just to show you the difference from the regular mask also, we have it here. We have the face shield.
May I just comment? This is a regular mask, surgical mask, that we use to prevent droplet infections. And actually for Ebola, Ebola is not an airborne one. Ebola is not an airborne infection. However, such patients may aerosolize the virus when you're doing suctioning or when they're bleeding heavily. So it is safer to use the N95 mask that we usually use to prevent airborne infections. And we have, as Marita said, we have two types, the duck-shaped one and this one. And you really have to be fit tested to choose the right type and the right size, because they come in different sizes, medium, small, large, for each for each type. So you really have to be fit tested. There's a fit test, and we've actually opened now the service for fit testing. And we'll be doing this even before before the Ebola outbreak. We started arranging for this, just to make sure that when you wear this mask, it is going to be protective. Okay.
We have the face shield and hood. Note that we also have different types of face shields. This is the face shield. The face shield with built-in surgical hood that has a strap inside to secure the placement later. We have regular hood without face shield. When you use this type of face hood, you have to make or to use additional face shield outside.
So just show them if you use this hood that has no built-in face shield.
This one will be worn outside.
So then you have to wear this one on top of it. Okay, this way. Of course, you'll have to put the mask. We'll show you now the full PPE, but I'm just showing you the difference. But if you use this one has a built-in face shield. So if you use this one, then you don't really have to put the face shield, the mobile one.
So all of this face hood and shield will protect your eyes and neck, and it will provide additional protection to the whole face. The healthcare worker must wear a pair of cleanable shoes. It should not be cloth, clogs or boots. It should be no holes. Okay. And of course, the alcohol-based hand rub and the disinfectant wipes. As you can see here, we have 3 chairs labeled. This will represent the chair. Should be outside the patient room, and the 2 chairs there located at the anteroom, where the doffing will be done.
So just to explain this a bit more, you cannot really don or put on the PPE and remove them in the same area. It's not allowed to do that. Donning the PPE should be done in a clean area that will be outside the patient's room. that can be outside the patient's room. And we'll reserve the anteroom. Anteroom is the room, the small room that you have to pass through before you enter the isolation room. That anteroom will be the dirty room. Where we will put the chairs, these chairs, in the dirty room or the anteroom. This is to remove the shoes, and this is to remove the booties. And there will be a chair in the clean area for the reasons that we'll mention now. So now this is the clean area, and this is the dirty area.
So before we start with the donning procedure, make sure that all personal items such as pagers, ID, mobile phones should be removed. You should not bring these items to the patient room.
You see, she removed all of her belongings. Very important.
Okay.
Yes.
To start with, Marisa has to clean her hands with alcohol-based hand rub. This will take approximately 20 seconds. Make sure that the proper steps are followed to cover all areas. No area should be missed. And ensure that hands are thoroughly dried before putting on the pair of gloves. When her hands are dried, she has to put on a pair of nitrile gloves.
One thing that we have to remember is that you should untwist the strap, and we assume that she has chosen the right size and the right type.
Okay.
So this is her size, say medium size. So you should only use the size that fits you well.
Now at this point, she has to perform a seal check. Seal check is different from fit testing. Seal check should be done every time you wear an N95 mask, while fit testing is done once to choose appropriate size that is suitable for you, and whenever there is facial changes like surgery or increase of birth for the male. To perform this seal check, put cup hands over the face mask or the mask. Gently inhale and observe collapse, and exhale for bulging of air. There should be no air leaks or escape around the mask to make sure that you are properly fitted.
So if the mask is properly fitting, when you blow air, it should bulge. If it doesn't bulge, the air is leaking from the sides. It is not well fitting, and you can get infected. And when you suck air, it should collapse, which means that it is not leaking from the side. If it doesn't collapse, there is leak. So you really have to adjust it, and make sure that you do the adjustment before you go into the room, because inside the room, it is absolutely prohibited.
The gown.
So the inner gloves should be under the sleeves of the gown, under, not above. Okay.
Sit on the chair and put on your booties. From the beginning of this procedure, you have to make sure that the available size is ready for you. These booties should be pulled up and extended up to the cuff.
People there. Can you see it?
Now put on your second pair of gloves.
So now you have to put two pairs of gloves, an inner one and an outer one. We don't recommend putting more, because if you put more, you lose the dexterity or ability to do things in a good way. So you may actually expose yourself to needle stick injuries because you cannot really have good feeling by your hands. So it's recommended just to put at most 2 pairs of gloves, no more.
Make sure the cuffs are pulled over the gown. This time over the gown or the sleeves of the coverall.
And this is what will happen in real life. The trained observer will be reading out the instructions to the one who's going to enter. She has to read it out in practices. So she put her gown, she tucked in her gown under the gloves cuff. Good.
Okay. Now you can put on your face shield with surgical hood. Make sure that all parts of your face, neck, eyes, and head is covered. The trained observer may help. Okay. Turn around. You have to make sure that you can move freely and comfortably.
Actually, just a second, you really have to do this. You have to make sure that you're moving freely. She's not doing just doing it just.
This is part of the...
You really have to make sure that you're moving freely, so that when you go into the room and try to do something, bend, or then you don't get surprised that the PPE is out of place. So you have to make sure that your movement is free and is smooth.
Now Marisa is...
And the trained observer has to make sure that there is no gap in her skin or in her clothes. She has to be covered all around. So she has to turn around and show the trained observer that she's fully covered from head to toe. Yes.
Now I guess Marisa is ready to go to her patient. Wait, I'll give you an alcohol-based hand rub.
Now she's allowed to go into the patient's room. And now she went into the patient's room. Of course, before you examine any patient, you have to disinfect your hands, of course. So she does now disinfect her gloved hands. And now she goes in to help the patient or to provide medication or take blood or whatever. Okay, now she's done.
When she's done, she has to prepare for doffing procedure. It is very important to keep in mind that doffing procedure can be very dangerous if you don't perform it according to the sequence or properly. You have to make sure or take extra caution to prevent contamination. Do not leave the room until the trained observer is ready to observe you. So I'm ready.
So the nurse should not go outside the room until she's sure that the trained observer is there waiting for her. Okay? So she should not go out and call the trained observer. This is not allowed because she will contaminate the environment. She should stay in the room until the trained observer is ready to see her.
The trained observer has to check and inspect her by asking her to turn around and see possible tears or cuts from her personal protective equipment. If there are tears or cuts or visible blood and body fluids, it has to be disinfected with disinfectant wipes, hospital-approved disinfectant wipes.
So if, for example, she sees blood spill or anything on her gown or in her dress, then it has first to be disinfected by a wipe, by this one.
Okay. Perform hand hygiene.
Okay.
Now she's disinfecting her outer gloved hand. The trained observer should maintain a safe distance from the healthcare worker. After that, she has to sit on the chair.
So this is now the chair in the dirty area. Her gown is considered to be dirty, contaminated, so she's sitting on the dirty chair. Okay.
Remove your booties by rolling down technique slowly to avoid exposure.
And don't rush. Rushing is dangerous. Take your time in removing the PPEs. Now, as we said, actually doffing or removing the PPE is dangerous. It's very dangerous. So it's more important to watch the removal than it is probably for putting on the PPEs.
Perform hand hygiene again before removing outer gloves.
So now the new recommendation is that you have to disinfect your hand after removing each PPE, each piece, yes. After each removal of each one, you have to disinfect your hands before you move to the next one. Yes.
Carefully insert one hand at the inner side of other gloved hand to remove outer gloves, making pocket.
Yes. Remove the other one. Did you remove the other one? You removed both? Okay.
Inspect for possible tears in the inner gloves. Perform again hand hygiene. Now she can remove her face shield. Slightly and carefully tilt head forward.
Bend forward, please.
Bend forward.
Bend forward, yes. This is how you should remove your PPE, your hood. Just throw it away right away. Okay.
Perform hand hygiene.
She made a mistake, a major mistake. What mistake she did? She touched her hair. This is very dangerous. And this is why we said, don't adjust anything with your contaminant. She's trying to adjust the strip. Help her now just to put it back. Yeah. But this is not part of the demonstration. Huh? No. Put it back. Well, you see? Put it back. Above the ear, yes. Yes. You know, such a simple mistake actually that she's done can actually be the cause of infection. Any error in removing the PPE can lead to infection. And this is exactly what happened to the nurses in the States. They did such mistakes during removal of the PPE, and they got infected. Okay. So it's very important not to do any mistakes during this.
Slowly and carefully remove coverall in a good trick to avoid contamination. Insert hands at the inner side of the coverall.
You should make sure that you don't touch your cloth, huh? Yes. Can she sit on the chair?
Yes, you can.
She cannot, yes. Because now this is her cloth. She cannot sit on the dirty chair.
Perform hand hygiene. Now sit on the other chair.
No.
Yes.
No. This is wrong. To do what? No. She should. Sorry, this is the chair you use? Okay, yeah, sure.
Sit here.
Sorry, that's okay.
Sit
She
here.
can sit on the other one. Sure.
Sit on the chair and disinfect your shoes.
She can sit on the other chair for shoes removal, but she cannot sit on the booties chair because that one has been contaminated already. Yes. So now she's disinfecting her shoes.
Another hand hygiene should be performed after disinfecting the shoes. Now you can remove your inner gloves.
Just show them how you did that. When you remove the left one, when you remove the left glove, you touch it from outside and try to pull it. Don't try to remove it from the cuff. Pull it from the middle of the glove and remove it. But then, with your clean hand now, you cannot touch the surface. Like, leave it. You cannot touch it from here. She cannot do this. She cannot remove it this way. She has to insert her finger, because this is clean hand now, from the inside of the cuff to remove it.
Perform another hand hygiene on the bare hands. So make sure that all areas of the hands are covered. And when hands are dried, you have to put on a new pair of gloves.
Now she has to put a new pair of gloves before she removes her mask. So you have to let your hands dry before you put on the gloves, otherwise it will be difficult to glove. As you can see here, she's having difficulty because she hasn't yet allowed the hand rod to dry. Yes. And the rubbing should be for 20 to 30 seconds. For the alcohol to dry, you need at least 20 to 30 seconds.
Okay,
Don't rush. Yes.
Remove your N95 mask carefully. Lean a little forward. Pull bottom strap followed by top strap, carefully avoiding contamination without touching the front of N95 mask.
So never remove the mask from the front. Never, ever. Always remove from the strips behind. And then make sure that when you're removing it, it's not touching your cloth, as she did. So you have to bend forward and do it.
Perform another hand hygiene before removing that gloves.
Good. And now she removes the gloves. Good. Good.
Perform another hand hygiene on bare hands. The trained observer finally asks the healthcare worker to turn around and finally inspect and check her if contamination has occurred. Actually, she did well. So, she can take shower after.
Yes. It is
We can
recommended.
give her a big round of applause.
It is recommended that the healthcare worker takes a shower after doing all of this. So it's recommended. It's not a must, but it is better to take a shower. Just one last thing. Just show them, Marisa, just show them how to don this PP, this mask. So the way to don this mask is that you have to hold it this way, putting the straps behind your hand. Just show them how you do that. Put it on your face. So you put it, and then start with the lower strap, put it around the neck, and then the upper strap above the ear. Yes. And then you do the seal test, below and suck air. Okay, very good. So anything else? Now we'll open the floor for any questions. Thank you very much, Maritas and Marisa. This was really very good demonstration. Thanks a lot. تفضل. ما اشتغل؟ اضغط عليه شوية.
Thank you, Prof, for this education and presentation. My question about fifth type of Ebola, that's cause disease in animal but not cause disease in human, can be used as treatment or vaccine.
Actually, the resistant strain causes disease in monkeys, It does infect humans, but doesn't cause disease. There is now intense research to develop a vaccine against Ebola. And actually, there is one now available. There's one now available, but it hasn't yet been tried. So we cannot recommend it as a standard practice yet. The manufacturing, there are actually more than one. The manufacturing companies will start using it in the epidemic countries to see if it is efficacious or not. I'm not sure which viral strain they used, but I don't think they used the Reston one. They probably used another technology to develop this vaccine.
The second question, practical question. If this patient arrested.
Arrested?
Yeah.
Yes.
It is safe to do CPR for those patients?
CPR intubation is a high-risk procedure, very high-risk procedure, because now you're aerosolizing the virus. And this is also applicable to MERS corona. So you really have to be 100% sure that you're fully protected with N95 mask, face visor or face shield, all PPE before you do the resuscitation. So if you see the patient arresting, your health is a priority. So don't rush and resuscitate him without PPE. Don't rush, because we tend to rush to save patients' life. Don't do that. Don't do that. You have really to wear full PPE before you resuscitate this. And we should hopefully prevent such event from happening. If the patient was closely observed, then you would realize that he's collapsing very soon, so you should be prepared before the arrest. So we don't like to reach to the stage where you have to rush and resuscitate your patient because he wasn't observed. So in a good hospital, patients who are deteriorating should be transferred to the ICU and should be under really good control. And the people around should be wearing already the PPE. So if he arrests one of a sudden, then people will be ready and fast to resuscitate him. تفضل. طيب first تفضل. Well, yeah, no problem. Yeah, sure, but never use it again. Yes, just throw it away and then use a new one when you go in. So you can stay with it as long as you're in the room, but when you go out of the room, you remove it. Yes. تفضل يا دكتورة. Again, please. Good, very good question. She's asking, we have an anteroom. Now the nurse went into the inside room. And now when she wants to go outside, it is recommended that you use paper towel to open the door knob. The door is closed, so you take a paper towel and use the paper towel to open the doorknob, because your gloves will be contaminated, and if you try to open the door with your gloved hand, then you may contaminate the knob. So you have to use paper towel to open the door to go into the anteroom, and then get rid of the tissue. Thank you. This is an important point. Anything else? Any other comments? Yes, please. Yes. No, where's the paper? No, actually, it's not too expensive. I'll show you can you get the paper, please? Paper is abbreviation for Powered Air Purifying Respirator, PAPR. Powered Air Purifying Respirator. And this is recommended as an alternative to N95 mask, because people with a beard may not have a good fit with the regular masks. So this is what is recommended for those with a beard. And it is like, it's a battery-driven mask that they have to wear, and we can show it to you. We brought some supplies we needed. Actually, the battery and the helmet itself could be expensive, maybe say 1,000 riyal each, but these are not disposable. The ones that is disposable is only the visor and the whatever, but the disposable part of it is cheap. The helmet itself is expensive, I know, but you need only say 2 or 3 for your facility. Say the question again. The WHO and CDC are different. Yes. 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 Yes, both actually are correct. When you don't expect aerosol generating procedures in an Ebola case, then you can wear a regular mask. But if you anticipate any splashes of fluid or aerosolization of fluid, or you have to intubate, or you have to give a nebulizer, or to put a BiPAP machine or whatever, anything that may aerosolize the virus, then you have to wear an N95 mask. Oh, you work in Fagih Hospital? That's fine. Okay. Please, I'll give you a phone number of the Director of Supplies, Dr. Abdullah Zahrani. He's really an excellent person who can give you immediately whatever you need, or at least tell you where to get these PPEs from. Yes. Yeah, sure. Any other questions?
Assalamu alaikum. Thank you very much for your very, very, very explicit explanation and well-researched topic. Now, my question is just, has it been confirmed now, the portal of entry for the virus? Now, in spite of all these PPE the people are wearing, sometimes by mistake when they are removing, they get infected.
Sure.
Does the virus infect people on normal intact skin, or it has to be broken skin, the first line of defense?
Excellent question. Really excellent question, because people have noticed that despite all of these barriers, people still get infected. And the major risk for that is exposure to body fluids. And most of these people actually had intact skin. So there is now concern that the virus may actually penetrate an intact skin, and we never know. We haven't been able to confirm this. But we should assume this, that the virus can penetrate an intact skin. And this is why we don't allow any exposure of the skin when dealing with such patients now. It's absolutely prohibited. So I agree that there is a big concern that this could be a virus that is able to go through an intact skin, but we don't yet have a proof for that. So you really have to take your full precautions, assuming that the virus is able to penetrate intact skin.